The Cuban doctors will be tested for the virus just before they come out of their isolation. Dr. Mkhize appeared unimpressed with some of the responses to the arrival of the Cuban medics.
I would have expected that South Africans would have been cheering to say thank you for coming to assist us, thank you for coming to reinforce us. I don't think it is correct to have all these snipes and jibes and negative sentiments, because it just really is an unnecessary kind of stereotype. Well, as far as we're concerned, Cuba has got one of the best health services in the world.
Some of the Cuban doctors will be dispatched to two Eastern Cape hotspots, Buffalo City and Nelson Mandela Bay. Dr. Mkhize also left the province satisfied with the turnaround effected by the province in its fight against COVID-19 so far. His last visit 2 weeks ago didn't go so well. He raised concerns which have so far been addressed. These include the setup of infrastructure and the appointment of medical personnel. More than 800 nurses have been employed in the past 2 weeks. The sharp rise in the Eastern Cape infections and the issues surrounding the influx of people from the Western Cape were also discussed.
The relationship between the Western Cape and the Eastern Cape, literally, this is a point that we've actually been discussing. The people who are in the Western Cape and the Eastern Cape are the same community. And the movement between there is not even an incident. We were talking about this and laughing, because somebody can actually wake up from Libode and then go to Cape Town, and then the following day he's back, and it's like he's just gone to town and came back. That's the nature of the connection between all our people. And therefore, when there's one area which is affected by the outbreak, certainly the one nearby is going to be affected.
The visit was also part of the preparations for the provincial visit of President Cyril Ramaphosa later this week. Xolani Sichinga, SABC News, East London.